Alrighty. So we've already done the first part. This is the second part of the head to toe assessment. And so before we begin, I've already performed YPA, so I've washed my hands, introduced myself, provided privacy, identified my patient using two identifiers. I've explained everything and also assessed for any allergies. And so without further ado, we're gonna go ahead and get started. First, we're gonna be doing the upper extremities. And so first, we're gonna be doing this by doing some range of motion. So if you could just put your hands up to the sky, all right, and then back out this way. And then if you could turn around and put your hands and your thumbs together, make sure the camera sees that, all right? And now if you could just put your arms out like this to the side and back down, and, excuse me, also put your hands straight out, and I'm gonna just bend your elbows for me, bend it this way, all right? And then bend it forward, there you go, and then can you put your hands towards you, like inwards, like put your hands this way, yeah, there you go, and then do it the other way, all right, and now, let's see, I'm forgetting something. Well, she was able to perform I'm forgetting something. Let's see. Put your hands out this way, and then can you do the finger thing? This, okay, and then now can you grip your hands for me? Okay, and then push. All right, and then pull. Alrighty. So she was able to perform full range of motions without limitations, and also there was no crepitus noted, and there was no muscle wasting as well. You want to take a look at your fingernail beds? Okay. Her nails are pink and flat and smooth, and the cap refill is less than 3 seconds, so that's intact. I guess we're going to go ahead and move on to the next section, which is the chest area. So as I'm looking at her, I see that her transverse diameter is a 1:2 ratio. She doesn't have any barrel chest. Excuse me, and can you turn back for me this way? And as I'm looking at her back, her scapula is straight. Her spinous process, her scapula is even, and her spinous process is straight. And you can turn around now from the camera. And her respiratory effort is it is effortless. She doesn't seem to be in any shortness of breath or anything like that. And yeah, so with my patient being pregnant and everything, I'm not able to percuss or palpate, but if I was to percuss the anterior part, I would percuss this area right here, right above the clavicle, and then right below, and then right down here, just right above the breast area, and then inside right here, and then right below right here, and then we'll also do one right here, and then also right here. I would percuss in those areas, and I would hear resonant, and also same for the back. I would percuss in 9 areas. Same thing, so above the shoulder here, right below the clavicle here, and then basically just going all the way around the scapula. So then go right here, right here, right here, right here, right here, and right here. And those would all be resonant as well. All right, and so now we're gonna go take a listen to her breath sounds. I would be listening for bronchial sounds, which it would be in the throat area right here. Bronchiovesicular would be right here, and then vesicular would be right here. And in the back, there is no bronchial sounds, but bronchiovesicular would be right here, and then vesicular would be right here. And so because of time, I'm going to I'm only going to listen to a show where I would auscultate. Like I said, because of time limits, I wouldn't actually listen for the full breath sounds, but I would do it in real life situations. So I would listen here, here, and I would listen under the shirt. Here. And then right under here, and here, and here, and then right over here. And the anterior chest area, everything was clear to auscultation, so there was no adventitious sounds or anything like that. Same for the back. Listen here. Listen here. And I would listen under the shirt. And here as well. And everything in the posterior side was clear to auscultation, and that there was no adventitious sound as well. All right, so now we're going to move on to the heart, and for this area, I would listen to the bell. I would listen with my stethoscope with the bell and diaphragm, but because of time, we're not actually going to listen to the bell, but I would use the bell to listen for S1 and S2 and for any murmurs. But for today's sake, we're only going to listen to the diaphragm and listen for each section of the heart. So we're going to start by listening to the aortic, which is the second right intercostal space. Yeah, second right intercostal space. And then pulmonic. And then, hang on, I think I got that backwards. I believe I changed what I said. Aortic will be on the second left intercostal space, and then pulmonic will be on the second right intercostal space, I believe. Actually, no, I don't know. I lied. We're gonna just keep what I had. Aortic will be right here on the second right intercostal space. Pulmonic, second left intercostal space. And then Erb's point will be on the third intercostal space, left sternal border. And then tricuspid will be in the fifth intercostal space, which is going to be right below here in the left sternal border. And then the mitral, which is the fifth intercostal space on the mid-clavicular line. And as I'm listening to all sounds, I heard all heart sounds were present in each area. So that's it for the heart. Anyways, okay, so now, yeah, I believe that's it for the heart. Now we're going to go ahead and move on to the breast. Let's see, for the breast, let me think about this real quick. Well, I guess, actually, before we do move on, the PMI, I want to palpate the PMI. So if you could have, if I can have you lay down to your left side, and I'm going to palpate your PMI. All right, make sure that we're in there. Okay. So just put your arms up to the side, all the way up. There you go. And normally I would do this for 1 full minute, but like I said, for time's sake, we're just gonna do it. Okay, so I'm gonna find that. And then I would also and I would also count the apical pulse and the radial pulse with that as well. And I would also do this for, like I said, 1 full minute, but for time's sake, we're not gonna do that today, and that would be 2+ and equal bilateral as well. So, do you need some help getting that? Thank you. All right, so I believe that's it for the heart. All right, we're gonna go ahead and move on to, so we've got the heart and then now the breast. And so first, I would inspect the breast for any dimpling, induration, any bulging or anything like that by having the patient put her hands to the side and kind of moving her shoulder forward just a little bit and then putting her hands up behind her head. All right, so there was no indurations, bulging, anything like that going on. Also, I would use light, moderate, and deep palpation using the balls of through my fingers by starting at the tail of spins and going down the bra line. Tail of spins is right here, going down the bra line, and then moving over an inch, like towards the midline. I don't know if y'all can see that. And then going back up the tail of spins, and then basically following that same motion until you get all the way to the sternal border. And I would be palpating those, and then using my thumb and forefinger, excuse me, to compress the nipples and to make sure that there's no discharge as well. Also, I would be palpating for any nodules. It should be non-palpable, but central axillary would be like right here if there was any. Pectoral would be right here. Subscapular would be right here, right behind the, kind of right here. I don't know how to explain that, right here. And lateral axillary would be right here, and then epitrochlear would be right here. And so, like I said, those lymph nodes should be non-palpable, and you shouldn't, like I said, you shouldn't feel any of that as well. So there would be no tenderness or masses noted for that. All right, so I guess now we're after the breast, we're gonna go ahead and move on to the abdomen. So if I can have you lay down again, sorry. You're fine. Got it. All right. So just put your shorts down just a little bit. All right. Like I said previously, I'm not going to be palpating and percussing my patient today because she is pregnant. So I'm just going to verbalize everything I would do. And so first of all, as I'm looking at her abdomen, I noticed that, you know, there are some striae. I don't see any scars or anything like that. I do see some prominent veins. I don't see any pulsations or any irregular movements. I don't see any discolorations as well. And so, like I said, my patient is pregnant, and so if I was to percuss, I would percuss starting at the, I'm gonna go right behind you. I would start by percussing at the right lower quadrant, and then the right upper quadrant, and then I would percuss at the left upper quadrant, and then left lower quadrant. And once I get done percussing, everything should be tympani. And also now, if I was to palpate, I would ask my patient first if she was in any kind of pain, and if she was, I would go and do that last. Like I said, I'm not gonna palpate, but if I was to palpate, if she wasn't in any pain, I would go the same motion. So I'd go from right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant, and I'll also document those findings. So now I'm gonna be listening to her abdomen. And I'm also going to be listening for any hypo or hyperactive bowel sounds with my diaphragm. And if I don't hear anything within 5 minutes, I move on to the next quadrant. But, okay, so bowel sounds is present on the right lower quadrant. All right, bowel sounds is present in the right upper quadrant. Bowel sounds is present in the left upper quadrant. And bowel sound is present in the left lower quadrant. Alrighty, so I believe that's it for the abdomen. I'm gonna go ahead and get up from you. Thank you so much.
Thank you.
You're a rock star. Alright, so now we are going to, I guess, go ahead and do the spine in the back. So if you could stand up and we're gonna do some more range of motion stuff. But first, as I look, if you could face all the way back there. All right, as I'm looking at her back, I see that, like I said, her scapula is even, her spinous process is straight. I don't see any abnormalities in any way. So if you could turn this way for me, face that wall, and act like you're diving in a pool just to see if you have any scoliotic deviation. Okay, all right, so the spine is straight, so there was no scoliotic deviation noted. Now we're going to be doing some range of motion. If you could just face the camera for me. Can you turn to the left side for me? Okay, and then right side, and then back, and then forward. All right, did you feel any pain there or anything? Okay, so she was able to perform range of motions without any limitations, so she was good there. Let's see, after the spine, oh, that's what I was going to do. Okay, can you turn it on for me? All right, so I did forget one thing. So as I'm also looking at her back, I see that her cervical spine is concave, and then as I'm going down, her thoracic spine is convex, and then as I'm going back down to her lumbar area, it is concave. And so I believe that's everything for the spine. Now we're gonna go ahead and move on to some cerebellar function. So if you could just perform some things for me. So if you could pat your hands for me. All right, perfect. Can you touch your finger to my finger, and then touch your nose, and then touch my finger? Okay, keep doing it, and then do it outside. Okay, all right, and then can you do the finger to thumb test once again? Perfect. And now can you just sit back up here and do the heel to shin test? So if you could just put your one leg up to your knee and put your, shield down, good. And other side, perfect. And can I have you stand up, and we're gonna do the tandem walking. Have you ever done that before? Mm-hmm. Okay, all right, so we're gonna perform tandem walking, but first I'm gonna just scoot my camera just down just a little bit so you guys can see. I'm gonna try not to get out of the frame. All right, so if you could just tandem walk for me. Perfect, and then can you repeat that once you go back? Perfect. All right, thank you so much. So cerebellar function is intact. She was able to perform all of those things without any limitations, and she wasn't in any pain or anything like that. So now we're going to move on to the sensory. First, we're going to assess for dull and sharp pain. So if I could have you close your eyes and just let me know if you feel sharp pain. First, I'm going to say this is sharp, and then this would be dull, okay? So just let me know what you feel. Sharp, 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 dull. Perfect. All right, so she was able to do that, and now we're going to do the light touch. Just let me know when you feel the combo with your eyes closed, okay? Now. Perfect. All right, so she was also able to assess, she was able to tell me light touch, and so that is also intact as well. All righty, so now after that, we're gonna go ahead and move on to some, the lower extremities, some range of motion once again. So if you could put, can you put your head down there and we'll lay down? Yeah, perfect. You need some help? Right? I got it. Okay. All right, just wanted to make sure. All right, perfect. So, all right, so can you push against for me? All right, now pull for me. And now can you raise your left leg up all the way to the sky? And then same thing for the other side. Perfect. And then can you put your left leg to your chest? Or try to, yep, perfect. And then the right leg, perfect. And now you put your feet flat up against the table. Okay, and now can you pull against resistance, and then now push, perfect, and now can you spread your legs like outwards that way, perfect, and go back up, and then can you do some abduction, so can you straighten this leg out, and then stick them to the side, perfect, and then same thing for the other side. sorry. Yeah, no, you're fine. Perfect. All right, so she was able to perform full range of motion in the lower extremities without any limitations. And so she was good there, and also that there was no crepitus noted in any areas. So now I'm going to take a look at her nail beds on her toes. I see that it is pink, it is flat, it is smooth, and her calf refills are less than 3 seconds, so those were all intact. All right, sister girl, we are done with the lower extremities. We're almost there. So now we are going to move on to do some reflexes, the deep tendon reflexes. First, we're going to start out by doing the biceps area, and so I'm going to put my thumb right here, like on the bicep, and actually I'm going to be on the other side, because I feel like, yeah, there you go. If you could just listen for me, and I'm basically just going to strike my hammer to my thumb and look at for any reflexes. So I would normally do this both sides, but for today I'm just only going to do one. So relax for me. All right, so there was that bicep reflex was present, and it was a 2+, and so now we're going to go ahead and do the tricep. I'm going to go ahead and relax for me. I'm going to do it right. I don't know if they can see that. I think I'll do it there. Right here. Okay, that was also 2+ bilaterally, and now we're going to do the brachioradialis. So I'm going to go 2 to 3 centimeters right above the radial, the styloid here. And I'm going to strike that with my hammer. Okay, so reflex was present there, so that's a 2+. Now we're going to do the patellar. I'm going to find that notch right there. Alrighty, so that is a 2+. So that reflex was also present. Now we're going to do the Achilles. Dorsiflex your foot for me. Try that again. There we go. Alright, so that's a 2+. And now we are going to do the plantar superficial reflex, which is the Babinski. Now this is going to be, might be a little bit ticklish, so I apologize in advance, but we're just going to draw an upside down J towards the medial. Alright, so that was a negative Babinski test. Alright, I believe that concludes everything for the reflexes, and so now we're going to move on to do the pulses. Like I said, the reflexes, everything was a 2+, and it was equal bilateral. So now with the pulses, I would also do it on both sides. For time's sake, I'm only going to do one and grade them. So we're going to start out with the radial. Alrighty, so that is a 2+, and now we're going to go down to the, no, not the radial, this is the brachial, I'm sorry. Brachial is a 2+, and then radial, so brachial is 2+ equal bilaterally, radial is 2+ equal bilaterally. Ulnar, which is the medial, right here, that's also a 2+ equal bilateral. Now we're going to do the popliteal, which is behind me. All right, that is a 2+ equal bilateral. Now we're going to do the posterior tibial, which is like kind of in the inside of, but the back right here. That's also a 2+ equal bilateral, and then dorsalis pedis, we'll do it right here. I don't know if I can see that. All right, that's also a 2+ equal bilateral. Like I said, I would do it on both sides, but for today I only did one. And so now, I believe the only thing we've got left, or I've got left to do, is the genitalia. So if I had a male patient, I would first of all inspect and see, I would inspect to see a dark, coarse, curly, and thick hair. It should be an upside down triangle. I would also inspect and palpate the penis for any nodules, any inflammation, any rashes, anything like that. I would also inspect and palpate the scrotum for any nodules, any rashes, any lesions or inflammation. I would also check to see if the urethral opening was, no, that's for the female. Never mind. I would also check for, what is that? Oh, I would also palpate the scrotum and inspect and palpate the scrotum behind the scrotum for any nodules, lesions, or anything like that. There should be no hair anywhere in the scrotum or penis area. Like I said, it should be thick, coarse, and curly. And I would also perform a rectal exam and inspect for any hemorrhoids. And yeah, so I believe that's it for the male. For the female genitalia, I would again inspect for dark, coarse, curly, thick hair. It should be like an upside down triangle as well. I would inspect the labia majora, labia minora for any lesions, nodules, any rashes, inhibitants, nits, anything like that. I would also see the urethral being open. I would also inspect the vulvar area for any discolorations or any bulging, specifically any bruising as well, because that is a sign of abuse. Also for the female, I would inspect for, I would also use the rectal, use the rectal exam for any hemorrhoids as well. But yeah, so I believe that's everything that I've done today. So I think we are good on this second part. Thank you for being my partner and patient, Brittany. I appreciate it, and thank you guys for watching.